Laying the groundwork for a new, innovative era at the School of Medicine, Dean Mark Gladwin has launched GenMD, a strategic plan that forges a path forward for our missions of education, research, clinical care, and community. The plan was developed with input from hundreds of faculty educators, scientists, clinicians, and community partners.
I'm very proud of this engagement process. We essentially had 40 engagement events. About more than 900 faculty, 66% of our faculty were actually at one of these events. And these 40 events were departments, some of the large divisions, for example, in the Department of Medicine, the institutes, the centers, the programs. So these 40 events were events where we really heard from you about what mattered to you. This was followed by 9 prioritization meetings, which were representatives of the faculty now trying to prioritize all of the feedback and the concepts in the areas of change that you all asked for. And there were 9 of these events and an additional 2 with community, really reaching out across West Baltimore, across our communities, to come up with prioritization lists of things we should be doing at the University of Maryland School of Medicine.
16 major goals actualize the vision set forth in the plan to drive change across the School of Medicine and align with the University of Maryland Medical Center and the University of Maryland, Baltimore.
So if you look at all of them, for example, within the educational domain, how do we recruit? How do we retain our best medical students, residents, fellows? How do we deal with the rising cost of medical education and generate more scholarships? How do we inspire and support our clinician educators? They're sort of the bedrock of the culture and values of our institution.
The goals and objectives are specific, aspirational, and concrete to solve the complex individual and global health diseases and health disparities faced by millions across the nation.
And this includes things like the aging of our population, the challenge of the brain itself, from addiction to neurodegeneration to autism, the addiction epidemic itself, metabolism and obesity, zoonotic infections, climate medicine, a warming planet, highly overcrowded planet with zoonotic infections and antibiotic resistance. These sort of themes underlie the strategic plan to really inspire us to think even beyond the day-to-day objectives that we focus on as well, to try to make the work that we do easier and more efficient.
The plan includes 2 levels of accountability at the leadership level to ensure that faculty and staff are empowered to achieve all of the goals and objectives in a timely fashion.
That part of our job in leadership and part of the institution's job is to allow you to realize your potential. We want you to be able to work in an efficient, competitive way. And so many aspects of the strategic plan are really focused upon improving or operationalizing the efficiency of your work, or empowering or supporting you so that you can realize your best potential.
So with the roadmap in place, implementation starts now.
We firmly believe that we're in the right place at the right time with the right people to tackle generational challenges in science and medicine.
For the University of Maryland School of Medicine, I'm Larry Roberts.